Before we bring in your partner, I just want to ask you a little bit more about the thoughts you've been having. You said you're awake at night worrying and it's hard to turn your brain off. Can you give me an example of some of the worrisome thoughts you have?
Yeah, sure. I haven't really felt right since the baby was born, and I was wondering if there's something wrong with me physically. Like, what if the nausea and headaches are from some kind of infection or cancer? Well, what if we were just starting our family, I found out that I had something that could kill me? And then there was a patient at work last year, a mom with 2 young kids, and her breast cancer came back, and it was terrible. Real tragedy. What if my baby grows up without me?
Have you talked to your OB at all about any of these worries?
Yes, she said my blood work looks fine and I just need to eat more, stay hydrated. But I keep thinking that there could be something missing.
So that sounds really hard. How do you handle it when you have that kind of thought?
Well, sometimes I try to tell myself that I'm being silly, but a lot of the times I can't get it out of my head. I try to do some research online about my symptoms and what might be causing everything. So far, I'm not sure what to think. It seems like some of what I've been experiencing could be part of an illness, like ovarian cancer or lupus, and I'm wondering if I should see a specialist in cancer or rheumatology. I can't stop thinking that something is very wrong.
I'm really sorry to hear that you've been having those concerns. It sounds like you have worries about your health and you just can't get them to stop. How often do you find yourself going online to look up things about your health?
Well, at night when I can't sleep after feeding the baby, it's one of the things I do.
When you're just lying there?
And I'm on my phone or my computer.
Mm-hmm. So do you think you're doing it pretty much every night?
Probably, and sometimes during the day.
Like, do you have any other things that you try to do or feel like you have to address the worries that you have?
Well, I have to wash everything really well. It's exhausting, but the pump, the bottles, it just takes so long, and then I have to start all over again. And if I don't do it right, then the baby could get an infection.
Do you find yourself worrying a lot about the baby's health as well?
I know he's really healthy, but he's so small and he breathes funny when he sleeps. There's a chance of SIDS, and it's hard for me to think he'll be fine throughout the night when I leave him.
So you're worried about his health as well, and sometimes you'll even worry that he might even die during the middle of the night?
Yeah, it feels silly, but I can't stop. I check on him to listen to his breathing, and it makes me feel better for a little while, but it doesn't help for long.
Tell me more about how often and what you're doing when you're washing the pump and the bottles. Are you finding that you're having to wash them more than once each time? Do you feel like, sometimes people feel like they have to wash it a certain way every single time until it feels right?
Well, it seems like I have to wash it 4 or 5 times to make sure it's clean. Like, it could be dirty if I don't, and if it touches something dirty, I have to start all over. It does take quite a while, at least an hour in the morning and at night.
And how much time do you think you spend during the day checking the internet for symptoms that you might have and then looking up different diseases that you're worried about?
Probably around 2 hours total between nighttime and during the day.
So these worries that you have about your health and the baby dying and then your behavior with checking the internet and the bottles, I wonder if it could be related to some type of obsessive compulsive symptoms or obsessive compulsive disorder, intrusive thoughts that are difficult to get out of one's head, rituals or repetitive behaviors that go along with these that can be really common in the postpartum period. We have specific treatments for it, such as antidepressants, usually at higher doses, and specific types of psychotherapy that we use called exposure and response prevention. These symptoms are really common with depression and anxiety, and they can all be interrelated. They can also get worse when the depression and anxiety get worse. Would it be okay if we talked a little bit more about OCD even with your partner as well?
I've heard the term OCD before, but I never really understood what it was. I thought it was people wanting things neat and orderly. Could I hear more from you first, then bring my wife in?
Absolutely.